So in keeping in theme with talking about innovation, we talked a little bit about the FIT Fund last night, which is the Funds for Innovation and Transformation. And we are lucky that 10 Albertan organizations have, through this fund, designed, tested, and are at various stages of testing and designing social innovations across the world. And to do this work, they collaborated with partners in many different countries, and we're joined by those partners today. Angus, if you could get the... As we heard yesterday, social innovation doesn't work unless it's endogenous, unless the community itself is driving it, unless the community itself is working towards it and are involved. And we want to discuss and think about this morning what it means for innovation to be locally driven and what it means for the people within these communities to be the change makers, to be the entrepreneurs, how we can achieve better results and better impact when we are working together with people who are living and experiencing the challenges that we're trying to address. Social innovation works when we reflect on the assets a community already has, the skills already within a community, the ideas already within a community. And that's what we're coming together today to hear about. In this panel, we're privileged to have, and I'll just introduce you all quickly, Maria Inestroza. Maria is with Pure Water for the World Honduras, and they have partnered with CAWST on their FIT project. We also have Dr. Troy Cunningham. He is with Operation Eyesight in India. We have Joseph Bangura. He's in Sierra Leone with the CAWST partnership. And we also have Edda Muller. And she partners with Change for Children in Nicaragua? In Nicaragua. So welcome to you all. And I hope you can see everybody in the room. Everyone's excited to hear from you. And we'll just get started. So to start us off, while we know that they have partnered with organizations here on FIT funds and FIT projects, we also know that they all do incredible work within their organizations, much wider work. They partner with other organizations around them and around the world. So I thought we could start off by just hearing from all of you a little bit about yourselves, the organizations you represent, and the work that you do. And I'll call on you as we go around. Perhaps we could start with Dr. Troy Cunningham.
Yeah, thank you so much. A quick update on Operation Eyesight. We are an organization that was founded back in 1963, and we collaborate with our medical partners, our community partners in 4 countries in Asia and 8 countries in Africa, focusing on eye care services and more towards developing models that ultimately achieve quality, comprehensive interventions and sustainable eye care. I think that's really what we look at. And as early as 2009, we piloted something called a hospital-based community eye health model, and then moved to a community-based or a vision center-based model. And the whole focus of this interventions are to build the behavior change within the community itself to access services, but at the same time, at the supply end, make sure the hospitals, the staff are all equipped and able to provide the services. So we are in countries like Bangladesh, Nepal, India, Ethiopia, Ghana, Kenya, Liberia, Zambia. So these are some of the projects that or the countries that we work in. So that's a very brief about Operation Eyesight. Thank you.
Thank you, Troy. Maria, welcome. Tell us a bit about yourself and the work you do.
Hello, my name is Maria Inestroza. I'm the country director for Pure Water for the World, Inc. here in Honduras in Central America. I have 15-year experience in water supply hygiene promotion, including menstrual hygiene management and sanitation experience. Pure Water for the World is a 501c based organization, and it was born in 1999. It's also based in Rutland, US. We have our main office there. We have another office in Trojes in the southeast of Honduras. And we have a center office in Tegucigalpa, the capital city of Honduras. We also have projects and a program and offices in Haiti as well, in Lemonade now currently. And our main mission is to provide water, safe water, sanitation, and the tools and experience to maintain all these tools that we provide for the communities. And when I say we provide, it's just half of the provision, because the other half is usually driven by their own people. And we also have an association with CAWST, the Center of Affordable Water and Sanitation Technologies, and that's the reason why we're here today. The most recent project that we did together was, well, last year through FIT, some research about menstrual hygiene management and the acceptance of sanitary pads, reusable sanitary pads. So CAWST has been a very good partner to work with, as that lets us work throughout the world, and especially throughout Central America, as they have other water expertise training centers around the world. Thank you very much.
Thank you, Maria. Joseph, welcome. Tell us a bit about yourself and the work that you do.
Yeah, I am Joseph Bangura, Country Director for CAWST Canada, Sierra Leone Partnership. I've been with the organization since 2004 as a program engineer, working on all the infrastructural projects for CAWST Canada. And after several years, from 2014 to now, I'm the country director of CAWST Canada in Sierra Leone. CAWST Canada Sierra Leone Partnership is an affiliate to CAWST in Canada with headquarters in Albertan. It was established in 1988 in a small town in northern Sierra Leone, that is Kamakwie, which is 56 miles from Makeni, which is also 118 miles to Freetown, the capital city of Freetown, of Sierra Leone. So our main areas of operation over the years have been in the area of education, supporting and promoting education, and as well as working on the health sector, especially in malnutrition. This was done in collaboration with UNICEF, Sierra Leone. And even most of our educational programs are also supported in partnership with UNICEF Sierra Leone. These have to do with working with out-of-school children, especially the girl child, and also working with mothers clubs. These are community structures which support us greatly in attaining sustainability in most of the projects that we do. And we also work in the disability area, wherein we are working in 4 districts in Sierra Leone out of the 16 districts, supporting the socio-economic reintegration of people living with disabilities, and also working on their functional and physical rehabilitation, as well as promoting and working on advocacy for these people. And we also work on other issues that are really affecting the communities, like issues relating to teenage pregnancies, early marriages, and also on gender-based violence, especially school-based gender-based violence. So this is what we do for now. Thank you.
Thank you, Joseph. And Edda, welcome. Please tell us about yourself and the work that you do.
Muy buenos días, mucho gusto y agradecida por la oportunidad.
I'm very pleased to meet you and I'm grateful for this opportunity.
Mi nombre es Edda María Muller Narváez y soy de la etnia Misquita.
And I'm from the community of Mesquita.
Represento a la entidad de Cambio para los Niños desde desde hace más de 3 años en cooperación con GTI.
For 3 years in cooperation with the GTI.
GTI es Gobierno Territorial de las Comunidades Indígenas.
Government of the indigenous community.
Es un territorio que se encuentra ubicado en el norte del país de Nicaragua, fronterizo con Honduras, departamento de Jinotega, y forma parte de la biosfera de Bozaguas. Y desde que empecé a elaborar para Cambio para los Niños, he atendido en la parte del proyecto de tecnología y educación. Y actualmente, pues, con el nuevo proyecto de conocimientos locales. Solamente.
Thank you, Edda. And thank you all. Thank you. And thank you to all of you. That's a wide breadth of work and different gaps in your communities that you're filling. And it's very interesting to hear. And my next question comes round to the issue of social innovation. And we heard in our discussions yesterday that social innovation is about entrepreneurship. And I'm interested to know, in your communities, in your civil society spaces, what opportunities are there for entrepreneurship? What new ideas or space for new ideas exists for civil society actors, for people within community who may have a new idea? What is the space like? Is it conducive to new ideas? What new ideas are coming up that you are seeing within the areas that you are working in? And how are those being fostered? I could call on people, but whoever wants to go first.
Yeah, thank you for that question. And basically in India, what we have seen is NGOs have always worked on proposals and concepts and implemented within the community. But over the years, there has been a shift towards more of stakeholder involvement so that you get to hear what the community is thinking. Through stakeholder engagement, then interventions are designed and implemented, and then the whole concept of evaluation with baseline and end line to understand what was the effectiveness of the project. So when you look at those models, there was very minimal involvement of community. And later in the last 5 to 10 years, community engagement has improved in the sense of identifying the local groups like women self-help groups, trying to understand what they think of what are the health issues, and then slowly bringing them on board to be messengers of what the project wants to achieve. Again, I still say it's an innovation in progress, but trying to really bring the whole empowerment structure back into decision making is something that is still rather new. We are on our way, but we still have, I would look at the co-creation level, which is really the true spirit of community engagement. So we are on our way, but not really there as yet.
Thank you, Troy. And the issue of inclusion and at which level and when and co-creation is really at the heart of what we're here to talk about today when we talk about voice and community voice. So thank you for that intervention. Maria, I think you wanted to come in.
No, right. For example, innovation comes in when something that already exists doesn't work. For example, in our cases, for example, in Honduras, we are used to the government putting water systems, gravity-fed water systems in our communities. But for example, in the areas that Pure Water for the World is working, those communities have limited access. And bringing all these materials and all this investment to a community, it's very expensive and sometimes impossible because of the access. So in this matter, like the doctor explained, you have to go to the community and talk to them and see how together you guys could solve problems. And one of the things that have worked for us as a community, as an institution, is to bring easier things to that a family could work with. For example, the biosand filter. It's not a big water system, it's not a big investment, and you could get the counterpart from a family to place a simple water system that is going to treat their water and it's going to prevent some waterborne diseases. And you just have to select a technology that will last for a longer period of time, because there's a lot of technologies out there that as donors want to test in communities. And sometimes they keep inventing and inventing technologies. And instead of stopping and asking the end user, is this technology that you already have working, and why change it? And if it's working, why change it? I mean, maybe it's more modern, the one that you're bringing, but it's not going to last as long as the one that I currently have. So in this case, the biosand filters, together with the educational part, we've been back monitoring this type of technology in the homes. And with the education, we found out that they continue to use it after 10, 11 years. So it's not innovative because it's been invented a long time ago, since the Maya times here in Honduras. But then through David Mans, it came to CAWST and to CAWST to pure water. But now we delivered it to the communities, and they have accepted it. For example, not in all the communities of Honduras. You have to find out in which context you're going to work. You can't put copy paste in all your projects. You have to go and talk to them and see what their needs is, and see if you're capable of bringing these alternatives to them. And if you're not, don't promise things that you're not going to be able to continue and to monitor them.
Thank you, Maria. I'm hearing context matters, even within a community, even within a country. And something that we also heard last night, you can't have innovation for innovation's sake. It has to match what the end user needs. It has to match what the end user wants to use and is comfortable using, right? Thank you. Joseph, did you want to come in on this issue? And you're muted.
Yeah, thank you. Talking on assets and strengths possessed by our communities in which we work, I want to start first of all by talking of the people we work with. And I want to make this very clear that the people in Sierra Leone, though of different tribes, are people that are very hospitable, and they are people that like to share. Hospitable in the sense that if you go to a community reception, whatever you want to do in that community will not work. So in this case, our people in all the parts of the country that we worked in, they are very hospitable. They receive our staff and they work with our staff well. And the other aspects that they are good at is sharing. Though these people are poor, because that's something I'm going to stress on. They are poor, but at least they have the heart of sharing. Now, staff go to the field. It's not a matter of like bribing, but it's part of the culture to receiving guests, to receiving people who go into your community. Whatever little they are ready to share. And that helps us a lot over the 30 years that CAWST has operated in this country. And we are working with a youthful population. Sierra Leone, most of the population are youths. And we have graduates, very young graduates, like a young lady by the name of Evelyn, who graduated from Frobe College on social work, inspiring young girls who left school, who dropped out of school through teenage pregnancies, through early marriages, and they've expressed their desire to go back to school. There was a time when most of them have given up school completely. But the inspiration got from these young ladies made us to register over 800 of them. And for now, we have more than 600 that have transited to the formal schooling. These are girls within the JS, the junior secondary school 1 up to junior secondary school 3. So these people are very youthful, and they are ready to challenge the terrain of Ouagadougou district and Calabar district. The guides, the young boys, they themselves using bikes in rough terrains and also very poor roads, especially during the rainy season. It's only young people that can work in these communities, which are hard to reach communities. The second aspect that helps us in our work is there are national development plans set at national level and cascaded up to district level and up to chiefdom level. So all our projects are aligned to these national development plans and the district development plans. So you see that we are working closely with national and district and chiefdom stakeholders in all our projects that we do. And as I just mentioned, most of these communities have got very strong administrative structures headed by council chairmen and by the principals, headed by the paramount chiefs and then section chiefs. And as you go down up to the level of a town or community, you meet people there who are responsible, and there are stakeholders who work with us to make sure that whatever we are doing becomes a success at the end. And something also very unique about Sierra Leone is that though we have over 16 languages with different ethnic groups, with different traditions and cultures, but there is one language that binds the entire country in one. You can come from the north, you can come from the south, or you can go to the east and to the west and work conveniently. And that's the lingua franca, that is Creole. Coming from any part of the country to work in another part of the country is not an obstacle. Creole helps us to communicate well with the people we work with. And again, we have people who have been exposed, who have exposed themselves over the years that have returned to these communities. We also have educated people, civil servants who have served the nation in several capacities in other parts of the country who return to these communities. So when we do our work, these are all our partners, these are all our colleagues, these are all the people that we work with to make sure that our work becomes successful. And in the country also, we've got laws which helps us, especially in the education sector. We have the compulsory primary education law, which asks every child of school-going age to go to school. And our country is also part of the Convention on the Rights of Children and also recently women's rights. So all these ones embedded help us to move smoothly with our work that we're doing in the field. And to end it up, to crown it, we also have people with skills, because at times we need to build schools, we need to build water wells, we need to build VIP latrines. These local people are available in these communities, and they all help us to move on with our work. And the last of it all is the staff, of course. We go the extra mile in whatever we do. By that, I mean, like I give an example of the Mothers Club concept, which was developed and introduced to NGOs in Sierra Leone. The aspect of providing them with grants, which was frowned at the initial meetings in Freetown, finally came into being because of CAWST intervention. We went ahead and supported them with some of the grants. And today, there is no project which UNICEF Sierra Leone is funded without the aspect of providing some grants for the mothers clubs, looking at what they were capable to do in promoting the education of the girl child in Sierra Leone. And also the SMCs, these are the school management committees. These were people that are, these are committees set by the Ministry of Education to look after each school in the country. But again, they were not provided with funds. With our own initiative, we were able to provide them with funds. And for all these years, all our districts of operations have been the best in terms of SMC's performance, because with those funds, they were able to repair schools, to repair the floors of portal floors, windows, broken doors, and providing benches and chairs for the kids. and also during the Ebola in 2014, and also Corona during 2019, we came up with the CLEA, C-L-E-A, community-led Ebola action, and also community-led Corona action. This was something initiated within the CAWST family, wherein from all the literature that we've gone through and all other strategies, this is to tell you that these are not new strategies, and as far as our communities are concerned. In those days, when somebody is sick in the community, the relatives or the parents of that person are expected to go and report these issues to the paramount chiefs or the town chief, and then action is taken. And this aspect of taking people for quarantine is not new. If these are the types of diseases that are very contagious, these people are removed from their homes and taken somewhere else wherein they will not be able to contaminate the rest of the community. So these are all what we read in the Ebola, in the Corona, this isolation thing. It's not new. So we use that concept, telling them that this is not new. It's something you've been practicing before, so it's a matter of just coming back and putting it into place. And it helps us a lot, because Koinadugu never got the Ebola infection, the whole of the district where we are operating. Thank you.
No, thank you, Joseph. There's a lot of depth in what you said, and I heard about communities are complex and full of different people and who have different skill sets, right? And in order to work with community, you need to understand who the people are, you need to understand the skills they have, and to leverage those. The last bit about these strategies are not new is also very interesting to me. We can come in with innovations and think they are innovative, and yet they have been part of the community for a very long time and part of how people live for a very long time. So how do we leverage that, in the times of crisis like Ebola and COVID? Sure. Thank you. And Edda, I'll just come to you, and we're still talking about the assets a community has. We're still talking about the local knowledge and how that's being used, how entrepreneurship is grown within communities.
Hola. Sí, puedo aportar al respecto.
I would like to contribute in this regard.
Respecto a la pregunta, ahorita actualmente Cambio para los Niños está liderando el proyecto de conocimientos local, que surgió fortalecer los conocimientos en las comunidades indígenas. Partió desde el desafío que se tuvo durante el COVID, que en las comunidades indígenas de Bozaguá, sí, los indígenas fueron afectados con el COVID. Pero la creencia del pueblo miskito se inclina muchísimo a las plantas medicinales. Entonces, las curanderas fueron quienes lidiaron todo este proceso. Y fue el único territorio donde no se presentó muertes por casos del COVID. Y las curanderas son más respetadas. Y ahora con el proyecto actual se está fortaleciendo sus conocimientos y con un enfoque de género, porque también hay hombres curanderos. Entonces a los dos se les está apoyando con huertos para proteger las plantas de los animales, pues. Y pues innovador también porque se están usando las botellas desechables que están sobre las riberas del río y en las comunidades. Y ahorita estamos en ese proceso de construcción de huertos con productos desechables. Y también se está enfocando bastante en la innovación con un programa de mapeo software para lo de la gobernanza territorial. Bien enfocado también con la igualdad de género, ya que en las comunidades indígenas el hombre es el único que vela y lidera por la protección de las tierras. Y no se tomaba en cuenta a las mujeres en este proceso. Pero ahora en la actualidad las mujeres también forman parte de esto. Y ellas han expresado que están muy emocionadas porque ellas también son dueñas de las tierras y las merecen conocer. Y antes solamente eran utilizadas como para cocineras o para lavar las ropas de los hombres que trabajaban. Pero ahora no, ya van a conocer sus linderos y van a ser parte del proceso que se va a mapear las comunidades y el territorio. Y esto va acompañado también con la tecnología. Y los guardabosques son hombres ya adultos. Y ellos no tienen conocimiento de la tecnología. Pero para hacer posible esto, se está acompañando con estudiantes, hombres y mujeres que fueron parte del proceso del proyecto anterior de tecnología. Donde fueron preparados en las escuelas junto a sus docentes. Ahora ellos ya dominan lo que es el uso de una computadora. Y ellos serán que van a introducir los datos en el software para mapear su territorio. También se está apoyando a la organización de mujer. Que actualmente ellas estaban infuncional desde hace 10 años atrás. Y actualmente ya se volvió a reactivar y cuentan con sus documentos legales. Y las mujeres se sienten muy apoyadas en este aspecto. Porque ya se les toma en cuenta en las planificaciones comunitarias. Las autoridades territoriales está tomando bastante cuenta a esta organización para trabajar dentro de cada una de las comunidades del territorio. Y ellas actualmente no cuentan con ningún fondo pero están velando para que las otras organizaciones o instituciones apoyen a las mujeres y están velando por la igualdad y equidad de género. Ya que antes en el territorio no tomaban en cuenta a las mujeres. Incluso ahora el gobierno territorial ha orientado que en todas las actividades se debe tomar en cuenta a las mujeres y en las decisiones también. Incluso en la junta directiva del territorio, años atrás, no había ninguna mujer en la junta directiva. Y actualmente ya está una mujer y dicen que eso es demasiado logro para las mujeres de las comunidades misquitas. Gracias.
Thank you. Thank you, Edda. And you touched on so many important points. Sorry, Anne-Marie, I think you need to switch over. She's gone? Okay. You touched on many important points. In the beginning, you mentioned how local medicine women were the only ones able to go into community, you know, and it touched on something brought up earlier, you know, who is going with these innovations, who is going with interventions matters to a community. You can't just show up when communities have rules or have cultures and have ways that they do things. And you've talked about how women can be included. And when we talk about inclusion, we have to think a little bit deeper. Inclusion of who exactly? You know, it's easy to say you're doing inclusion and you've got men around the table, right? But what do you do to bring in women, and what do you do to bring in the more vulnerable members of community? Thank you. I'll round up our discussion with the last question. All of you have talked about how you collaborate with partners, with donors who are from outside of your community, even with government, who are from, you know, outside of your community, and how you collaborate and work with them in the projects you do. Meanwhile, we've been discussing different forms of collaboration here and how some of these can be innovative. We've heard about different types of financing that are not the usual aid approaches. We've heard about different types of granting, investment, you know, direct aid to communities, cash transfers. There's so many different ways of doing this these days. I'm interested to know from your perspective, what is not working? What is not working and what is? What are the best ways for communities outside to collaborate, to work and partner with you? What is the best ways for communities outside who want to help to enter your communities and work together with you? Maybe I can ask Troy.
Aportando al respecto,
Go ahead,
cambio para los niños tiene algo de que tiene muy buena comunicación y coordinación con las autoridades territoriales. Es con lo local, y el territorio local es la voz ante el gobierno central. Entonces, sí hay una buena coordinación, entonces siento que eso le abre puertas para hacer bien el trabajo en las comunidades. Y pues es cumplir con las normas que establece el gobierno de Nicaragua, e incluso el gobierno territorial también tiene sus reglamentos y normas a cumplir. Y cambio para los niños, respetan mucho las decisiones. Y eso hace que todo funcione bien en el terreno.
Thank you, Edda. Our keynote last night spoke about don't bypass the government, right? There's a tendency within civil society to go around government structures, and yet what you're hearing from you is there are regulations that must be followed, which help rolling out your projects. Yes, Maria, please.
Well, that was, for example, our case in Pure Water for the World when we began over 13 years ago in this region of Honduras near the border of Nicaragua. We're practically neighboring Edda in Honduras where we are working. At the beginning, we didn't bypass the government, but we tried working with the government. But usually the government doesn't have any funds, or they do, but they prioritize other needs such as electricity, roads, schools, paying teachers, and water is left behind, or sanitation is left behind. They would say yes to everything that you, if you request support, they will say, yes, you could have our support, but not our money. So in this case, that's where the NGOs come in, right? To support local government initially. And the problem is that you start with the government and 4 years later, that person is not there. And you have to start from the beginning with the new government because they don't have like a plan that the next government will follow. And I think that happens all around the world. But in Honduras, we face this challenge as NGOs. Now that we are in Pure Water, are also working in human response in this community where we're working in this municipality, Trojes. We were the only NGOs working together with Amigos of las Americas, only 2 NGOs there. While in the other region of Honduras, there's almost 20 NGOs working. And sometimes each NGO is stepping in the work that the other one is doing. You think you're doing a good job, but then all of a sudden there's another NGO that has their project. And they come and throw away all the effort that you've done with putting in a project, and they want to do their own way, you know. So in this case, you bear out the government. For example, they're like now in human response, the government is like saying, I don't want to meet with so many NGOs because when you activate an alert, an alarm, 23 NGOs come immediately to the human need, right? But I think the first response should be with the local organizations, even if they're NGOs or civil local NGOs. That should be the first response. And the other NGOs coming in should work through them. First the government, then the local NGOs that already know the context, have the trust of the people that are the end users. Because for us as Pure Water, it took us almost 3 years to gain their trust. Initially, they thought that we were a political party coming in and just placing blue filters in their homes, and they wanted them red if they were from the other party. But as we continue to with the education and trying to get through them to trust us that we are not going to promise and not fulfill what we said that we were going to do, they open their doors. And like our friend there said, they open their doors, they give you coffee, they expect you're another family member, but you have to do this in time, like not immediately. This is not going to happen immediately. You have to hear your end user and gain their trust. If you don't have their trust, no technology is going to last for too long. They're going to say yes to everything you bring, but they're not going to take care of everything you bring unless they trust that technology. And first of all, if they trust you.
Thank you, Maria. We often hear about communities that are over-engaged and over-evaluated, and you'll see as you drive past a flag of all the different donors in the one community, right? So how do you streamline that? And you also mentioned that first response should be local. When we hear about disasters or anything that happens out here, our immediate response is, we've got to go and help, right? And you're saying, stop and pause. What are the local organizations? What is the local government doing, right? Thank you. And Troy, I think you wanted to come in.
Yeah, thank you. Yeah, when we are looking at working with government, I think one of the important things for us in India is to be able to understand are the strategies really addressing women and girls. And so what we did in the innovation project of FIT was really to go down to the grassroots level and involve women, because the project also was focused on addressing the eye health barriers for women and girls to access, healthcare. And all the data was very evident to show that women had less access to eye care. And so the focus of the project was really to develop an innovative model in terms of how do we involve women and girls in eye health, and that becomes a showcase model to the government. And so we did it at two levels. One was to develop the innovation, but at the same time also involve local government structures which had women in it. And so when we looked at addressing myths such as, they believe that a squint or eye issues were sinful behaviors of the past generations, or otherwise when they looked at less access because women were more busy in the houses, we had to look at how do we actually address these myths and misconceptions and be able to bring out role models that could be replicated across other projects also. And so when we involve the women and the girls, we also had them look at the issues at hand. And when we discussed it with them, we asked them, how do we solve these kind of problems? How do we address and educate the community? And one of the key areas that we realized was that we are not trying to change something on the surface, but we were really addressing behaviors itself. And so that required behavior change, material and communication material. And so when we had a consultation meeting with the women and the girls, and we also got in the men from the community, but it was largely women driven. And we took each issue and we put it to the women and we said, what do you think is the best way for us to solve this issue? And they came with their solutions, local understanding of these situations. And then the next thing was, okay, so if this is the solution, how do we make it representable and easy to understand to the rest of your community? And so, in fact, we had a 2-day workshop where they took each theme, developed the solution, and then actually developed the storyline on how we would be able to deliver the messages. And it was very interesting to see the creative writer and the artist actually listen to the community and then evolve their messages, evolve their pictures. And in fact, when we were in the discussions, when the women looked at some things that the artists came up with, they said, this is really not going to fly with our community. They're not going to understand. This is how you need to present it. This is how you need to depict. This is the kind of message that you need to put in. So I think that was a very interesting learning for us, that, being able to know that there is knowledge at the community level, the solutions are there, the way we deliver the solutions, they do have a good understanding of it, but they were not simply empowered to be able to share this information. And a lot of the IC material that Ashley from Operation Eyesight, who is there, will be able to show you that these are all conceptual ideas that came from the women and girls in the community itself. And when we developed it, we went back and again asked them, we asked them to test it. And any edit that came on any of those documents were really grown out of the women's knowledge and understanding on how to package messages. And I think this is something where we are looking that over the next few months, this strategy can then be presented to the government to be able to say that bringing in the local communities, bringing in the people who have the issue the most, and engage them not just as a stakeholder, not just as a person who gives their opinion, but actually a person who co-creates the solution with the NGO, with the government. I think that is the most critical learning that we've had in this project. And a lot of the assumptions that we had also was tested when we wanted to engage girls in developing the message. We learned that we need to first work with the girls to help them change their own mindset before they become agents of change. And so this project has taught us a lot. And I think one of the key messages that has come out is that the women and girls and the communities do have a clear understanding they need to get a platform, they need to be empowered to bring these messages to the front. And then we are just real stewards of what the knowledge is there in the community, be able to help them to shape it and then help them to deliver it back into the community. And this is definitely something that could be a strong strategy, especially in countries where there are gender disparities on a regular basis. Bringing in these innovations to be able to address gender issues is definitely something that we are learning, and we feel that this project is going to give a lot of guidance to the way we shape and do our health work in the future.
Thank you for that, Troy, and we're privileged to see all the artwork here. It's up outside for everyone to see. It's really great to hear the story behind it as well. And we're just gonna wrap up and move to questions from the people gathered here, but I wanted to check, Joseph, if you had something you wanted to add to the
Yes, I have something to say.
I'm sure.
Yes.
Go ahead.
Yeah, as I mentioned earlier, the government has its 5-year development plans. Every 5 years, they develop a development plan, which is cascaded up to the district levels. And it is imperative that any project to be funded by donors must be aligned to these development plans, because at least they help support the government. Because whatever we do as NGOs, we are supporting, we are complementing the efforts of government. So projects must be aligned directly to these 5-year national development plans. And the project design must come or must be in collaboration with the communities, the beneficiaries who are to benefit. And this collaboration and participation must be right at the start of the planning up to the implementation. They should be part of the implementation and not only observers when it comes to implementation. So this will help them to know where the project is going, and at the same time, it can bring in ownership of the project. Because once the community owns the project, it's a project that is due to be sustained, you see. And the monies, the cash, the disbursements can be done to the local partner. But for me, I think it is good these disbursements are done on quarterly basis, based on quarterly reports submitted, so that from time to time, from quarter to quarter, we try to read the progress that is taking place in that. And within the project, the aspect of capacity building through trainings must be incorporated. Because if we want these community people to be part and parcel of the implementation, they should be trained so that they will be able to become people who can deliver well, you see. And moving forward, when the project is being implemented, there have been the case wherein the local partner implements the project and the local partner monitors the project, which is not right. For us, we designed what we call a joint monitoring program, wherein the local partner is part of the monitoring. The donor can also be part of the monitoring. The donor is in country, and the community, the beneficiaries, are also part of this monitoring, because it is good for them to also highlight what is going well and what is not going well. And that is even the essence of the joint monitoring. And then there should be review meetings. We hold the review meetings quarterly, wherein we meet and discuss the findings of the joint monitoring and find solutions. And those will help, those ones often help us to see how the program is going, where we need to readjust, we readjust. What is going well, we continue with what is going well. Thank you.